everyone. Okay, dangers of steroids. If you have an autoimmune disease, they're all very similar to one another, and I've pointed out in other videos that connective tissue autoimmune diseases are now more prevalent than cancer, yet most people have never heard of them. And the main course of treatment for them when all else fails is autoimmune suppressant steroids like prednisone or methylprednisolone. A lot of times what doctors will do is use steroids as a last resort. They'll give you what's called a a steroid dose pack, which is a 1, 2, or 3 week dose pack where you take a certain amount and you lower it every day until it's done. So if you have organ involvement and Celseptin and methotrexate and all that isn't getting things under control, then they'll put you on high doses of steroids, but they'll always try to bring it down to a maintenance dose. So whether you're on a maintenance dose or a high dose, it's really important that you're monitored closely for all of these things that I'm going to talk about. In my case, it happened to be my central nervous system and my muscles that were involved, which, is the same as, say if somebody's got kidney failure involvement. So you need the steroids to save your life, but it needs to be administered properly and monitored properly, because if not, the following is what can happen. I want to tell you a little bit about what led to me being on high-dose steroids and being left on high-dose steroids when I shouldn't have been. You should never be left on high doses unless it's, to save your life and all else has failed. What they should do is put you on a high dose, knock your immune system down, that's the goal, and then put you on a maintenance dose of steroids or a maintenance dose of Celseptin and methotrexate. So I'll go ahead and talk about what happened with me, and then I'll talk about the things that need to be monitored. Because these connective tissue diseases can trigger additional diseases, as it did with me, it triggered the neuromuscular disease. And what happens is, with the steroids, I'm able to move most of the time, but if I move too much, it starts taking over and starts paralyzing. And what will happen is I go to move an arm, like, for example, bring my juice to my mouth, in my bicep muscle or the muscle behind my bicep will paralyze, but the surrounding muscles will still work. And if I don't stop right away, everything starts to paralyze. And you guys will see in some of my videos, I draw my arms in because my upper arms those muscles tend to paralyze on me. I tend to talk with my hands. So then without thinking, I just pull them in and they're supported, and then I can use my forearms and my hands. But sometimes my hands won't work. And the disease affects things like my breathing muscles, swallowing muscles, more recently my heart muscles. When I try to walk, I can't really lift my feet off the floor. I have to scooch. And it's really strange to have like an inner thigh muscle give out on you. And yet your other muscles will be working, and within a matter of seconds, my whole leg will start paralyzing on me. And then it'll spread, and then it'll affect life-threatening muscles, your autonomic muscle system. They tried a lot of different medications with me because my doctor tried unsuccessfully to get a neurologist to do the muscle and nerve biopsy so that they could see which medications would more directly treat the nerve and muscle disease. So they had to troubleshoot and try different medications, and the only thing that my nerves and muscles responded to was steroids. So they put me on them, and they had to keep increasing it till they found a level that would sustain me. Now, I was intended to only be on this dosage long enough for them to get a nerve and muscle biopsy. And the problem was that the specialists, because of my insurance, they would just say, well, it's working. And so they waited. Well, if you wait too long and you're on high doses of steroids for too long, then you can't get an accurate nerve and muscle biopsy. And now, when they try to wean me down, my nerve and muscle disease just takes over. And I have trouble even while I'm on steroids. So even while on steroids, I have trouble sometimes swallowing, breathing, holding my head up, chewing my food. Sometimes I can't move my hands and arms. I do video emails because, I have a hard time typing a lot. I have a hard time sitting up and forward. I have to stay leaned back. And I can't walk other than to scooch to the bathroom. Sometimes I make my way down to the kitchen. That's while on steroids. So you can only imagine what it was like before the steroids. I mean, I was literally dying. I was getting worse every day. I wouldn't have lasted another 2 weeks to 2 months. Well, now I've been left on incredibly high doses of steroids. When the specialists do see me, they say, what? You're on what dosage? For how long? Oh, we need to get these biopsies and get to the bottom of this. We need to get you off of those. This is dangerous. Well, of course it's dangerous because chemotherapy is a steroid-sparing drug, and that's how bad steroids are for you. It's just some of the things, and I actually have a lot of these symptoms that steroids cause. Whether you're on a maintenance dose for more than 3 months or whether you're on a high dose like me for any length of time, you should be monitored bi-weekly or monthly for the following. Skin and tissue fragility is very common, but what's happening on the outside is happening on the inside. With me, I noticed the skin, I'd try to get out of bed, and I would just, start bleeding through my elbows. I have some clips I'm going to show you in the next video of some things that are really embarrassing, like the Cushing syndrome, things I never thought I'd be showing you guys. You can see I have my settings to make my teeth look whiter, but they actually are a lot grayer than this from the calcium being sucked out. And if that's happening to your teeth, it's happening to your bones. So your doctor should be checking you for osteoporosis as well as avascular necrosis bone disease, which is where the bone breaks down faster than the body can heal it, leading to total joint replacement, such as hip, knee replacement. Very painful, lifelong pain with that. Atherosclerosis, very common, very serious. You should be getting checked, I'm going to repeat this a lot, bi-weekly to monthly for these things. They are that common. Atherosclerosis is thickening and hardening of the large and medium arteries, and it can lead to stroke, heart attack, congestive heart failure, and various forms of heart disease. These are all permanent things that affect your health, and your doctor should be checking you bi-weekly or no less than monthly. Striae, which is scarring of the skin, it's stretch marking. It's like somebody pulled your skin really far and let loose and leaves a bunch of squiggly lines. It's permanent. Capillary fragility, you guys will also see this in the video clips in the next video that I'm going to show you. And that's where you get ruptured blood vessels. It's called capillary fragility with ecchymiosis, and that's because ecchymiosis is discoloration of the skin due to the capillaries rupturing. I have that very badly, and I'll suddenly bleed straight through my skin, but a lot of times I can see blood settling under the skin. Insomnia, agitation, physical anxiety disorder due to the hormonal imbalances in the brain. It's a physical disorder. Severe risk of infection, so if you catch a cold, you may catch pneumonia. You may not be able to get rid of it. Your doctor should monitor you bi-weekly or monthly for bacteria levels, because you can get a kidney infection, and it can kill you if you're on steroids. Other things that they should be monitoring you for bi-weekly or monthly: your calcium levels, vitamin D, very important, your potassium, magnesium, your phosphorus. I don't have much time, so that's series 1. Stay tuned for part 2, and I'll try to get a little bit more in depth about these. But what happened with me is I had noticed I've not been able to get care here in Wisconsin. You guys know I moved to Wisconsin to be closer to my family, and I thought I'd get better medical care here with the UW, but it's been almost a year, and nobody would touch my steroid dosage. They wouldn't monitor me. The main doctor apparently didn't know to monitor me. When I asked him about it, he's like, no, that's for the rheumatologist. Everybody says, no, that's for the rheumatologist. But nobody could get me into a rheumatologist. They wrote them. They called them. Patient advocacy called them and wrote them. And here it is over 9 months later, and I still am waiting for my appointment. And so I've been left on these high doses for so long that I now need to be in the hospital because my tissues are just falling apart, and so is my vascular system. And it's now reached a dangerous level. So not only is the disease itself dangerous because it's starting to affect my heart muscle now, my breathing muscles have been affected, but I actually need to be in the hospital more because of the steroid damage to my body. They have to balance that out before they can even begin to start to wean me and monitor me while they wean me down from the steroids long enough to try to get an accurate nerve and muscle biopsy, and then not to put me back on steroids while waiting for the results, but in the hopes that they'll be able to find a medication aside from steroids. Because, see, steroids, although you take them because they save your life if you have organ involvement or nerve involvement, nerve and muscle involvement, if not administered properly and monitored properly, can actually kill you. It's a very serious medication. It affects more than just those with the disease, but on average, each person in America knows at least 3 people suffering from these diseases, so it affects somebody who's close to you. I think it's important people educate themselves on these medications, because I'm finding that oftentimes doctors are not knowledgeable about it. I happen to be lucky. I called my primary in California. He agreed to see me, knew instantly that I needed to be admitted, did a ton of blood work, and I'm lucky that he does stay educated, but I'm finding most doctors don't. So you need to be educated so that you can be empowered and be in charge of your own health as much as possible. I put links in the description box. Please, I beg you to go through them. Thanks for watching.